All right, well, hi everyone. Thank you so much for coming out today and then coming to this event for Innovating Women's Health. So it's going to be a lot of applause. So we're so glad to have you and to learn more about innovating in the space of women's health. My name is Sophia. I'm an MBA student at the Degree School of Business and the Innovation and Partnerships and So we're joined today by speakers from FemTech Canada as well as IIB Health. But before we introduce our speakers, I'd like to introduce Mackenzie Bacon, the Innovation Partnership Manager for Futures Institute of St. Joe's.
Hi everyone, I'm Mackenzie Bacon. Thank you so much, Sophia. And St. Joseph's Healthcare is a world-renowned medical research leader, and we are also leaders in the care that we provide our community. Historically, we have been often too humble in showcasing our accomplishments as health innovators. Moving forward, we are looking towards celebrating and planting a flag to mark St. Joe's as a place to create, test, and spread the future of healthcare. So together, St. Joe's, in collaboration with the Research Institute and McMaster University, are creating opportunity for innovation, focused celebration for learning through our Clinic Innovation Hub, which will be described later today. We are also creating opportunities for engagement with our industry partners, which are some of you that are here today. And we look to connect with you and explore those opportunities further. We are also testing innovation through our groundbreaking research, our industry partner clinical trials, and through our clinical pilot projects in partnership with the Innovation Factory and the Synapse Life Science Consortium. Lastly, we are spreading innovation by adopting new technologies here in Hamilton. And we're doing this through programs that are funded through the Ontario Bioscience Innovation Organization, or OBIO, and through the Can Health Network. So as we build innovation, we know that it is imperative that we support innovation for all humanity, especially the underrepresented and marginalized populations. And so we hope that through today's presentation, you are inspired to play a role in female technology and the ecosystem. So before we get started, I just want to take this time to thank Sophia. She's played an integral role in planning this event today, along with the rest of our RHDH team and our admin team here at St. Joe's. And so from all of us here, we are grateful for hosting the leaders of FemTech technology, and we are very appreciative for all of you and your time today. So I welcome back Sophia to introduce our wonderful speakers.
So thanks, Mackenzie. I'd like to introduce our guest speakers now. We have Andrea Guest and Rachel Bartholomew. They developed and launched FemTech Canada in 2022 with the mission to serve as an inspiration for entrepreneurs looking to be innovative leaders in the space for women's health. It's a dedicated network for Canadian FemTech companies in providing resources and much needed attention in the space of innovating women's health. As program manager for FemTech Canada, Andrea works to recruit and support innovative companies in the space for improving women's health. Andrea is also the innovation advisor for venture growth at Innovation Factory, which is located here in Hamilton, Ontario, at McMaster Innovation Park, where innovative startups looking to accelerate their business commercialization can find support. Rachel Bartholomew, the founder and lead advisor of FemTech Canada, is also the founder and CEO of IIB Health, an innovative company focused on delivering improved standards of care towards women's pelvic health, offering holistic, patient-created pelvic health rehabilitation for both patients and clinicians. So now I'll pass it to our guest speakers to take us through their presentation.
Awesome. Thanks so much for everyone who came out today. And thank you so much, Mackenzie and Sophia, for inviting us here to speak.
All right, so I guess we introduced ourselves. So I don't think we need to do any more introductions, but and we'll talk a little bit about how FemTech Canada came to be. But first, we want to go through a little bit of the landscaping around women's health.
Fantastic. So we have a couple of objectives we set out for today. The first, we want to sort of talk about the term FemTech and what it means. That sort of sets the stage. The opportunities within women's health. And then we want to inspire everyone here today to problem solve in this space and how to be active and contributors within women's health. And then finally, we're going to give you some resources to sort of get started, whether you want to be a problem solver or an advocate in women's health. So first things first, we want to set out to define what FemTech is. And this is actually probably the number one question Rachel and I get asked, because it can be confusing. Sometimes folks think this is about just female leaders or women identifying leaders. But actually, when we talk about FemTech, we're talking about products and services that impact women's health and wellness. The term was first coined in 2016. So this is actually a really new sort of industry that has come together. And when we were thinking about what FemTech Canada meant, it was really important for us that in our definition, we brought in some intersectionality. We felt that, women's health can't just be about those who identify as women, but we need to make sure that we are including the trans community, the non-binary community, and those assigned female at birth. So at FemTech Canada, we define FemTech as technology, including products, services, diagnostics, and software that address the health and wellness concerns that solely, disproportionately, or differently affect women, girls, non-binary folk, trans people, and those assigned female at birth. Okay, so why is this important? I think, when we're thinking about 50% of the population, that is not niche. If 50% of your population is unwell or not living their best life to the best of their health and wellness ability, how do you actually move forward as a society, right? If you are a team, if you're a chain link, you're only as good as your weakest link. So we really need to be making sure that 50% of our population are able to live their best life. As many of you probably know in the room, women's health has been underfunded and under-researched for centuries, forever. So bringing attention to this space is highly important. And I think as we be more intersectional about what women's health means, we're also working within other diverse groups as well too, which is highly important. Rachel.
So I love highlighting some of the shocking stats, and I feel like this room probably already knows a lot of these stats, but I like to bring it up in some of those rooms where women's health maybe isn't as well known. Women were only required to be in clinical trials as of 1993. So a lot of the drug discovery that was done before then was largely on males, and males replaced women in those trials, and partially because women were deemed higher risk because of the chance of pregnancy and another life being involved. Some of the other stats, so 80% of patients with autoimmune conditions are women. Majority of heart medication was actually only tested on men. 80% of women are actually making the healthcare decisions. I think this is a big piece that we all know and understand. We see women having stronger side effects and adverse events than men in 90% of the cases. And women of color are 22 times less likely to be given pain relief in the ER. So these are just some of the shocking stats that I love to kind of drop for the room, just to show how archaic and behind we are in a lot of the aspects of research to the way that we apply products. And there's a great little video that we like to show to kind of highlight this a little bit more.
This is Reference Man. He's a white 30-year-old male who weighs about 155 pounds, and he decides how we live. For decades, industries have considered this the standard human and designed the world around him. Everything from air conditioning in offices to cars, even military equipment. But there are other ways we use Reference Man that aren't so obvious, like in medicine, where it doesn't just lead to discomfort. Here, the disparity can be incredibly dangerous for women.
A few years ago, something strange was happening. Headline after headline recounted a similar story. Dozens of women were crashing their cars under the influence of sleeping pills. In many of these cases, they had taken a dose of Zolpidem the night before. It's what you probably know as the common sleep aid, Ambien. The problem wasn't entirely the drug itself, it was the dosage.
Women and men were both prescribed 10 milligrams of the drug for 8 hours of sleep. But it turns out women metabolize the active ingredient in Ambien twice as slowly as men. That means by the time men woke up the next day, the effects of the pill had usually worn off, while for many women, the drug was still in their system. After the crashes, the Food and Drug Administration issued a safety warning in 2013 and changed the recommended dosage for women, cutting it in half. The reason the right dosage for women had been overlooked is that the clinical trials on Ambien focused on male test subjects.
If they're using this hypothetical average man and they're basing dosage on it, that's kind of scary. Not just because it doesn't apply to women, but because it also doesn't apply to a lot of men either.
There are several factors that can affect how a person metabolizes drugs, from size to body fat to hormonal fluctuations. And these factors can vary drastically based on sex. But many clinical trials don't account for this. They often don't include enough women as test subjects. And even when they do, data from women is often mixed in with data from men, which can hide sex-specific reactions to medicine.
I don't care that it's more effective for men. I just want to know, is it going to be effective for me as a woman? So you don't know that unless you look separately at those groups.
Take acetaminophen, the active ingredient in Tylenol. It's flushed from a woman's body slower than in men, so the prescribed dosage can put women at more risk for potential overdose and liver failure. And one heart medication that's supposed to prevent heart attacks may actually trigger one in women.
So we know that this is still a problem, but it's so hard to know how often this happens because there's no research. If the companies did a better job of looking at men and women separately and studying them separately, I think we'd have a lot more dosages that are different for women and men.
In 1993, the National Institutes of Health created regulations saying women must be included in human studies and have their data analyzed separately. But the problem is,
it's the FDA, Food and Drug Administration, that's making the decisions about what medications are being sold to you and to your loved ones, and they are not required to include women, people of color, people over 65. If you're only studying white men, you don't have to study as many people. The more people you study, the more it costs to do the research, but the more meaningful the information is, so that we can all make informed decisions about what's good for us.
So when we look at, a gendered lens on things, and I talk about this, and I know the rooms that I talk in, and we talk in about FemTech and women's health in general, I try to highlight that it's not all about innovation, creating a tech product or service or a consumer good. It starts at the research level. It starts at the way that we talk to patients, the way that we educate, all the way to the products and the services, all the way to the applications that we put this research into, and the access of products, services, research, innovation, and everything in between to the patient populations.
Awesome. So a couple questions for the room, and please feel free to just speak up. Let's keep this pretty informal, but what health concerns impact women? What comes to mind for you? Fertility. Pelvic floor, yeah. Mental health, yeah.
Body mass and bone density.
Yeah. Breast health, menstrual health, we hear that one a lot. Anything that comes to mind about what disproportionately affects women's health?
Stress,
Sure, yeah.
hormone.
Cardiovascular health is one.
Environment.
Big piece.
Great. Awesome. So women's health in Canada, I think when we started FemTech Canada, We have some sister organizations in the US and in France and Japan. Actually, there's a FemTech community in almost every country now, which is fantastic to see. But there's some really unique things about what it means to be a part of FemTech Canada and this growing sphere we have here. The first is access to care and improving care delivery. You know, we have such a vast amount of land here in Canada, and many of our populations still live in rural areas. So what does it mean to be innovating in a space where, you know, your product or service can't just be focused on a centralized urban community? The second is the multicultural nature of our society. How do social detriments of health impact the society that we have in Canada and the fabrics and frameworks of a multicultural society? How do our products and service affect each of us differently? And then finally, you know, even though we would like to think of ourselves as a progressive society, there are still many stigmatized pieces of health that evolve around women's health. Fertility would be one of them, sexually transmitted diseases. And how do we create more proactive pathways to diagnose sooner in some of these stigmatized areas? So we talked a lot about the challenges and you know, some of the raw facts that we're facing, but there are a lot of opportunities. And Rachel's going to dive into some of the nitty gritty of these opportunities, but there is significant white space that still remains for research, for innovation and growth. And that's really exciting. That means that all of our young, amazing minds that are coming out of our academic institutions in Canada have huge space that they can build and operate in. That means people that are entrepreneurs within organizations like St. Joe's have opportunities to make change and make significant change in women's health.
Exactly. So I'm pulling together, and sorry, this top bar is going to be covering some of this, but I'm pulling together some of the stats that have been pulled together from some of the large institutions that have been doing the research in this space. And what we've been trying to do at FemTech Canada is go into incubators, engineering capstone projects, you know, design projects that these young innovators can actually tap into, and essentially saying, hey, look at all these white spaces that occur in these different areas. And so these are some of the stats from the McKinsey research study that was done about the femtech industry. And they found a number of holes specifically around virtual oncology care, menstrual services specifically, menstruation products, large amount of companies, but really when it came to the services side and the diagnostic side, almost non-existent. Menopause, completely untapped. We're starting to see a big shift now. Unfortunately, even myself on the High Ivy side, I've been out looking for researchers to partner to do clinical research with. I have yet to find someone who solely focuses on menopause and has done all of their work in that space. Delivery of contraception and getting that out there. We know what's happening south of the border. And gynae infections and innovation in that space has also been largely untapped from a company perspective. When we tie into FemTech Focus, who was one of the leaders in bringing together the FemTech community in the US, they pulled from their database and they've seen less than 5 companies in chronic conditions, abortion, which has now just become hot now that things have happened south of the border, but also ovarian health, heart health, and some of these things that we unfortunately see, especially in our FemTech community, hair, skin, and dermatology, largely is direct to consumer and is all about anti-aging, which I don't know who here can anti-age, but if you have that pill, let me know. You know, and really not focusing on the science aspect and, you know, the clinical aspects of these things. And then finally, FemTech Health is another group that kind of came together and did some interactive polling globally as well. And they saw 10% of the market really focused in menopause, longevity. I think mental health is a huge one. We see a lot of mental health companies being established, but no real focus on women and the direct impact on the women's mental health side of things. And I wanted to pull together some stats about what we're seeing from our side of things. So it has been put out there to the universe that there's an estimated $1 trillion market size here. And I think this is a big piece that Brittany Barato, who works in this space, has been starting to pull together from a research perspective, because I experience this as well as our 80 companies in our database. We hear every time we talk to investors, this is niche, this is niche, this is niche. And when this started to get pulled together and started to come out, even now, people are going, no, that's impossible. So it's interesting from that perspective. And I have my next slide kind of breaks down what that $1 trillion looks like. But we have 80 companies in our database as of this morning. I pulled together, it was 76 before we showed up here, and we just got a couple more that came out of the woodworks. We categorize under 14 categories, which we'll kind of highlight for you all. But what we're seeing consistently across these databases is a large focus on menstruation, fertility, and maternal health, and a lot of products and innovations happening in those spaces. But we've also, from a global perspective, seen about 1,000 plus startups, and it's growing at a rate of 13%. I wanted to put this stat in here. So FinTech, financial technology is what we call it, has 30,000 startups alone in the US. So just for comparison, obviously financial technology is way more important. And that's sarcasm. 80% of FemTech companies are female founded, which is a big piece to, I think, a lot of this story and why a lot of these companies are started, but also why we're seeing it being so new and the struggles that our companies are going through. And I wanted to bring forward just how this $1 trillion is broken down. So we look at it from, the big chunks of reproductive, menstruation, and maternal health, really, highlighting this. But I think the biggest piece is now looking at breast and uterine, looking at chronic, looking at cardiovascular as some of these big emerging markets. I truly believe the menopause market can be even larger than what they're stating here.
Great. So our FemTech Canada ecosystem is, new and it is growing. I'm not going to go through each of these companies or categories, but just by this sort of logo soup, you can see where the concentration is and where the white space is. We are so excited about some of the work that's being done by a lot of these companies. They're Canada-wide too, I must say. Rachel and I are quite close with the neighbor companies we have in Ontario, but there's some really amazing companies coming from out east all the way to out west, and we're excited to see this space grow. So why we need you, whether you're a problem solver, a researcher, an innovator, a supporter, an advocate of women's health, we just need more people to be passionate about this space and understand that there's huge amounts of opportunities here, whether that's in a role you're going to take on as an innovator yourself, an employee, or even in just conversations you're going to have. Without everyone playing a role, we will lack in research. We won't be able to create better products, and ultimately we'll just keep the stigma alive, which we don't want to do. So even when you're thinking about the companies that you support and the products that you buy and the conversations you have, bringing that gendered lens to this can advance all of these areas. So what can be your first steps to being involved in the FemTech space? So the first thing is, where do you find inspiration? Well, think about your own experience. So, Rachel's going to talk at the end about High Ivy and how this grew out of a personal experience. We hear this a lot from our founders, especially, the women identifying founders who 80% of them who are innovating in this space experience this firsthand, or they saw their mother or their grandmother or their daughter go through this. So even if you're not a woman identifying yourself, I bet there's some women in your life who would happily share their experiences with you, which leads me to the second point, open dialogue. We need to be having these conversations. We need to be ending stigma. We need to be learning from each other to understand what shared experience we can have and what biases we bring to our own experience in order to continue to innovate and progress research as well too. Research, primary, secondary research. I mean, this is something I talk about all the time at the Innovation Factory, but primary research can start with talking to your neighbors. It can be, joining Facebook group and asking someone to have a conversation offline if they're posting about something. Primary research can start in your own home. So that's not something that's not tangible for all of us. And then, of course, secondary research, the internet is our friend and our foe, but it's a great place to start as well, too. Understanding the white spaces. Rachel went over them quite clearly, but just saying, okay, what else needs to be done? And is there an opportunity for me to contribute in these white spaces? Setting goals, what do you want to accomplish? Do you want to, just be an advocate in this space and continue to vocalize what needs to be done? Do you want to be an innovator yourself? Maybe there's some nonprofit work, but this ecosystem really is interconnected, and each of these roles has a place and has a part to play, is what I'm trying to say. And then finally, dream big. Nothing is impossible. All of the great startups we work with today started out as an idea, and so anyone can really set out and achieve anything. If you want to get a little bit deeper into the subjects that we have touched on today, we recommend two really excellent books. The first is Doing Harm by Maya Dusenberry, and the second is Invisible Women by Caroline Perez.
And Invisible Women will make you angry. So I'm giving that as a caveat. Sorry, I'll go back to that. Sorry, go ahead. Take pictures. Yeah. It'll make you angry. So I won't go through all of these points. I kind of want to take the funnel and start at the top and kind of go down. And one of the things that I try to lead conversations with is from an organizational level, and this is researchers to your average Joe to companies that are starting innovation in different areas. I always ask, how does what you're working on disproportionately affect women? And I've had some of the most interesting conversations, especially with innovators who are innovating in different areas of healthcare. And one of them specifically was Fluid AI. They're a local company up in Waterloo. And I asked Yusuf, who's the CEO, this question. And funny enough, when I asked him this question, he said, well, funny you say that. We went through all of our clinical trials. We did all of our work. We did all of our design and our research. We came out the other end and we started implementing the technology. And what we found was 80% of the population that is getting our product is women. And that was not something that they necessarily saw as the population when they were going through their clinical trials and pieces. And so what was happening in that research stage in the design phase all the way to then implementation ended up being very different, because a lot of the patients that they were treating and getting these surgeries, colorectal surgeries, were actually women that were dealing with the complications that needed to be monitored. And so I love sharing that, because it just shows you that every single company that exists out there working in different spaces, I bet you any money that there's some sort of implication to how they service women with what they're creating. And narrowing that down into the student and researcher side, so we actually bring this, like I said, to students as well. So some of this may not apply to some of you in the room, but we say join a hackathon, get into entrepreneurship classes, look at your design projects, look at your research that you're doing, look at different problem cases, case studies that exist, join a company. There's lots of people looking for internships and co-ops. So if any of you have students, this is something also that we'd love to pass on. And then finally, when we get into the company sphere, so I won't go through all of these points, but essentially we're here to help. if you know anyone who's interested in this process, is looking to take their research to the next level, take it out of the university potentially, we're here to help. Innovation Factory is here to help. One of the best ways to get started is to look at a business model canvas, and join kind of a community that can help support you through proof of concept, getting customer feedback, and then getting out the other side. And so FemTech Canada, we created because I got angry one day. I went into a local health food store, and there was a magazine on the counter, and it said, "What the heck is FemTech?" on the front cover. And it was a 5-page spread. I'm not going to out what the magazine was. I feel like I'm talking trash all the time, but and there wasn't one Canadian company mentioned. And I kind of pondered to myself, like, I know I exist, I have my, fellow friends that I've connected with in passing, but who else is out there? So I pulled together a database of about 51 companies that I found through my initial research. And then Andrea knocked on my door and she essentially said, "Hey, how can I help you take this to the next level? How can I help you operationalize this?" And so, yeah, the rest is kind of history.
So when we took all of, Rachel's research, Rachel's leadership, and combined it with, my desire to help operationalize things, we created FemTech Canada. We're on a mission to bring more resources and recognition to leaders who are innovating in women's health space. And we connect companies with, peer-to-peer support. We connect companies with resources, and really we're here to build a more robust FemTech ecosystem in Canada. So I mentioned one of our resources already, but the network that we have been building so far has sort of 3 key pillars of support at the moment. We run a bi-monthly roundtable. Our roundtables are open to anyone who is interested in FemTech, but our mission is sort of always founder focus or aspiring founder focus. So when we choose a topic for our roundtables, it's with founders or aspiring founders in mind. We've been on a bit of a fundraising a theme for the past couple roundtables. It's such an important topic, but bi-monthly we meet online. We offer peer-to-peer office hours. Some wonderful leaders in the FemTech space, Rachel being one of them, have offered up time in their calendars to give that guidance and that peer-to-peer support for companies that are either just starting out or well on their way and just want to collaborate and have that person to chat with and say, "Can you empathize with what I'm going through as a FemTech founder?" And then we are working to build a more online robust community. Since we are a Canada-wide organization, we operate a lot on Slack, on emails, on newsletters, but you can really build a robust community online. And we have conversations with founders in Montreal in our Slack who are asking about, grants that are available in Ontario for their other co-founder, or folks in Vancouver who are saying like, "Hey, there's this new fund open here, but it's actually open to everyone." So really, we're building this robust online community that can share resources. And we have a lot more coming down the pipeline as we sort of, the online network and resources is the base of our pyramid, and we're going to continue to pile on programs and services as we go.
Yeah. And just to kind of highlight on the online community side, I think there's been one thing that I've seen in that community is that we all help each other out. That's the lovely thing about, I feel, women, especially working in this space, we lift each other up. And so we've pulled people out of, going bankrupt, finding investors, and connecting and kind of pushing us to the next level.
We couldn't do this without the support of our advisory board. The majority of the folks you see on your screen are founders in the FemTech space from across Canada. We also have one woman who is a leader in Indigenous women's health, and they've really been a sounding board for what we want to bring online and the mission that drives FemTech Canada. So couldn't do it without them as well too.
Yeah, they keep us sane.
Just a shout out again to all the companies that are in our database, and it's constantly growing. The collection you have in front of you range from, folks who are newly incorporated and getting their feet on the ground to folks that have raised Series A and are excited to be paving the way of this landscape in Canada. And I'll close off with giving Rachel the floor to talk a little bit more about High Ivy and her experience as a trailblazer in FemTech in Canada.
Yeah, so I was told I'm not going to do a formal presentation, but I was told to kind of just share my story and what I've kind of been through. So High Ivy came out of an unfortunate situation. I was diagnosed with cervical cancer at 28 years old. I was actually a patient of Gervinsky and still am. So God bless anyone who works at Gervinsky. I love you. And, you know, I had been an innovator in the past. I had started a company. I had worked in different innovation spaces. And I took a break, obviously, to go through treatment. And when I went through treatment, I was handed this 84-year-old technology that was going to be kind of my demise as I go through treatment and out the other end. And I looked at it and I'm like, come on, we've got to do better than this for women. And I always say after my surgery, my brain was running 100 miles an hour. It could have also been the drugs, but who knows? But my body was kind of on a shutdown mode. So I wanted to keep myself busy. And part of what I did was join the Facebook groups of other women going through cancer and talk about what they were dealing with and what were some of the problems with the current standard of care, knowing that I wanted to help innovate in this space. So I pulled together kind of that patient story side of things. We had over 500 patients chat with us through that process. I created what I say is the crappiest idea for a product on a PowerPoint presentation using smart art. I should always show it because it's hilarious. But when I started my radiation treatments at GRH, I was able to bring that in and talk. So it was funny. I was being lined up under the radiation machine from the radiologist, Bruce, at GRH. And I'm like, okay, Bruce can't leave my side as he's doing this. So this is the perfect opportunity to pitch this idea. And he couldn't leave my side, so he had to listen to me. But he actually ended up going and sharing across the radiation pods. And then I got back to my oncologist, Dr. Kobaleva. She invited me into her office and it was like, we need to have a chat. And I'm like, oh no, things are going wrong. Like, I'm dying. This is not good. And she's like, hey, I heard you're working on this thing. And it was really cool because it really kicked off the clinical validation that I do not come from the healthcare world, right? I am a patient with an experience. And I don't know how to navigate this other than I know I need to talk to doctors. And so what I did was I got that validation from Dr. Kobaleva and I asked, okay, who else should I talk to? And then I asked that person, who else should I talk to? And next thing you know, I've talked from gerontology all the way to pediatrics, all the way to every single person in between, and really got the validation that I needed from the clinical aspects. I made a decision really early on that I wanted to go medical first and not direct to consumer, which a lot of people, unfortunately, in the pelvic health space have went, knowing that when I got diagnosed with cancer, I did not turn to Gwyneth Paltrow to solve my problems. I turned to an oncologist, and I wanted to make sure that I created something that had that validation behind it. And, you know, as I started to dig into the research and pull together what our product could be, that's kind of what inspired FemTech Canada. I felt like I unearthed a conspiracy theory around women's health because it was just so under-researched, like basic anatomy of a vagina that's went through surgery, that's went through endometriosis, that's went through these things we don't even know. We look at vaginas on Google and it's like every single canal is a different shape and a different function, and you know what's correct. So I took a year to really dive into that research, do our own research. I went to the sex toy stores and I took a bunch of stuff and I hacked it apart and I put it all together to really go out and do the research that we needed to understand what our product would be. So we've created a smart vaginal dilator. what we're doing is essentially dilation with inflation. We're doing hot and cold therapy, so similar to hot and cold stuff you put on other areas of your body. We have that integrated in, and we're doing drug delivery and lubrication. So essentially it's like little Nespresso capsules that are punctured and sent through the device and out the other end. And we're measuring the impact of that with a bunch of sensors. And the fun, cool thing that we've seen with the sensor elements is all this interesting data that we're handing over to OBGYNs going, what does this mean? And they're like, I don't know, we should dive into this further. And we're seeing now that there's not only the therapeutic impact that we can have, but also potentially a measurement and diagnostic impact that we can have. So it's been an interesting journey. We're on year 3 of this. We have 7 different clinical trials at various stages. 1 at McMaster with endometriosis patients, 1 at Grand River with my own oncologist, which is amazing for pelvic-based cancers. But we're also exploring menopause, breast cancer, postpartum, and a whole number of different indications. And I'm on this journey to create a regulated product that is covered by insurance and has this ability to tap into, you know, diagnostics and measurement capabilities that we haven't touched before in this space. Yeah, I think that's the story. So that being said, thank you for your time today, everyone. This has been lovely. This is our first time doing this presentation and
Together.
together.
You've done it a couple
Yes,
times.
yes.
Yeah.
And we're hoping that we can keep going and keep this narrative going to all the universities across Canada and hospitals and beyond. So thank you.